All right, tonight's webinar will be recorded and will be posted on both of the U of M Extreme Weather website, our extension website, and the Red River Resilience website. So you can pass that along to others that you work with, and they can view that in their own schedule. So to get started, our objective in this resource fair is to inform local service providers of educational materials, programs, and resources that are available to address preparation and recovery from a flood. At the end of our presentation, you will receive a certificate of attendance, all of the resources presented in a white paper for your reference, and a 2-page sheet on the facts of resilience. This is the table of contents for the University of Minnesota Extension Floods and Rain website. What we will be going through first is the family section of resources on this site. In the family section, there are 5 areas included in how to prepare your family for floods. Get the right insurance, inventory your household property, protect your important financial documents, make a plan to protect your family and pets, and to keep an emergency flood fund. And now I'm going to turn it over to Sarah.
Thank you, Ellie. As Ellie said, I'm Sarah Krymans with the Extension Service, and one of the first steps is to get the right insurance. And it's really important for consumers to take the time now before a disaster happens to review their insurance policies. The action page, reading your insurance policy, can be used to describe the coverage one has under their existing policies. Flood damage typically is not covered by standard policies, so consumers may have to purchase additional flood insurance. We would suggest that you refer consumers to floodsmart.gov for more information, and there's generally a 30-day waiting period from the time an insurance policy is purchased to when it actually goes into effect, so people need to do a little planning. It's also extremely helpful if consumers have a household inventory prior to a disaster to aid in recovery. We encourage folks to check out the household inventory and the List It or Lose It, the case for the household and property inventory tools to aid in developing their inventory. The Minnesota Department of Commerce and the Insurance Information Institute websites also have additional information related to homeowners insurance, so we recommend they check those out. The second section of the U of M Extension Flood and Rain family page is inventorying your household property. So as mentioned previously, for information on doing a household inventory, the tool, the household inventory, provides a method of knowing exactly what personal property you own. Having an accurate household inventory is a necessity when you are a homeowner or a renter, and it can be helpful after a disaster as survivors try to claim reimbursement from insurance or on their taxes, or to obtain resources or assistance from other sources. Protect your important financial documents is the third section, which includes a red file, which helps consumers plan what should be in their grab-and-go case if they need to leave home quickly in the event of an emergency. The roadmap for important papers is an interactive fill-in-the-blank Word document that helps folks file or document all of their information in one place.
All right. The fourth section in the family section here is make a plan to protect your family and pets. And to get started in the process of creating a disaster plan, you can visit Prepare Your Families for Disaster, which is an online resource from the American Red Cross. And if you have small children, Sesame Street Let's Get Ready can really help you build a child-friendly kind of disaster plan. It's important to talk with children about natural disasters is the title of an article with tips for parents on talking with children of all ages during a crisis. And besides children, older adults can be particularly vulnerable if evacuation is required. You can see the document, it's a fact sheet, Before the Natural Disaster, Planning and Preparing Tips for Older Adults, for information to start the conversation with your older family members. To protect your pets during a disaster, you can go to Storm Safety Tips for Your Pets and the Pet Owner's Fact Sheet from FEMA.
Thank you, Ellie. One of my dogs just walked in, so the pet resources are so important. Keeping an emergency fund is the fifth section, which includes starting an emergency fund before disasters happen, which contains information on why should you start an emergency fund. The spending plan worksheet is an action page for consumers to document income and expenses and to determine how much they can and plan to save. The Getting Started What Can I Do action page helps consumers identify places to find money in their budget or in their spending plan to save. And then additional information on family finances.
All right, and then here we have listed the extension phone lines. The flood information line, this line is for questions about water, crops, horticulture, and climatology issues. And individuals who call can leave a voicemail after hours on this line. And the answer line is for questions about cleaning, stains, mildew, and food safety issues. And it also provides referrals for financial advice as well. This is a list of the flood fact sheets that are located on the U of M website. We've had a great response with both Talk to Children About Floods and the Red File, the Grab and Go case for emergencies. And here's a visual of one of the fact sheets. I wanted to show you this visual because I wanted to show you the format that they're in. So it's very easy for professionals to click on the fact sheet, print it, and have it ready to go for families.
The Recovery After Disaster, the Family Financial Toolkit, is available free online at the website or the web link cited. The toolkit focuses on all of the financial information and decisions to be made after disaster. As one user of our toolkit stated, the toolkit has valuable information to guide us during these tough times. You might wonder, how did this toolkit come about? Well, as with many places in our country, more disasters are happening in our state, and Extension has a mission to meet community needs. But before we created something, we needed to understand community needs through asking those impacted. We asked, what did you experience? What were the issues? What response strategies worked? And what would you like others to know to help them? After we obtained the answers to these questions, we then created research-based materials to meet the educational needs of those we serve. The toolkit was developed based on research conducted with disaster survivors and professionals 2 years after a flood had impacted them. The survivors and the professionals had had plenty of time at that point to reflect on their experience and to share with us what worked and what did not work. The toolkit was developed in partnership with the University of Minnesota Extension and North Dakota State University Extension. Because we share that Red River right on the border, this seemed like a great joint project. And the toolkit was funded by a Smith-Lever Special Needs Grant from the National Institute for Food and Agriculture. After its development, we had it nationally reviewed and piloted it with survivors. So you can see on the screen here the 9 units in the toolkit, and it is available again online. Folks can download it in its entirety or certain units at a time. And there are also versions specific to Minnesota or North Dakota. And primarily it's that last unit, Unit 9, with the additional disaster recovery resources for families that is the state-specific piece. The toolkit outlines several key strategies that can help survivors navigate the recovery process. So there are resources there and information to ensure that people obtain accurate information and not rely on just rumor. There's information on taking care of yourself, the Bounce Back and Adapt Journal, which we will hear more about, and you can see the other key strategies that are included in the toolkit. Our philosophy in Extension is to provide tools for people to make their own best decisions. And you'll see that we have correctly named this publication.
All right.
Tools to help families
So a person's mental, physical, and spiritual well-being will also have a very direct impact on a survivor's financial well-being. A disaster really forces you to make some rapid changes in your life, and it disrupts normal routines. And included here are some of the tips included in this section of the toolkit. It also provides the tools. In the tools section is the Resilience, Bounce Back, and Adapt, which is a journal that survivors can turn to get some concrete tips on how to bounce back and adapt during a crisis. And we will hear about this in more detail very soon. So as you can see from this quote on the screen, the toolkit is very widely usable. One user of the toolkit said they liked how well it worked for anyone, owner or renter. It didn't matter how much money you made or what your resources were. It was easy to read, understand, and use. These are sections of information located on the NDSU Extension Family section of their flood page website. These are the resources under financial issues, including sections from E-Extension and the National Flood Insurance Program. Apply for assistance through FEMA is another section here at the end of their listing of financial pieces available on their resource list. In their listing of resilience-related topics, many items here, as you can see, are from our Red River Resilience Group. So some great resources around resilience for families. This is their listing of flood-related topics in regards to children. And as we know, as family-serving professionals, it is so important to have readily available resources for ourselves and the families that we work with who have children. Here are additional links and also PDFs to download regarding children's needs. This is NDSU's listing of stress-related topics for families, from how to deal with stress to a stress test. Additional information is listed here on stress symptoms and also pieces around stress management. And their information also includes flood-related topics regarding pets, including a great short video clip on how to prepare your pets. E-Extension is a national internet-based educational network that it's very integral to and complements the community-based cooperative extension system. And this system has a 24/7, 365 days a year availability. Consumers can search a word such as the word flood, and the search will include over 1,000 cooperative extension sites. A person can also click on Ask an Expert on the site to ask a question regarding a topic and receive a response within 24 hours or less. First link, 211 information, has referral, crisis management services, and also information for family-serving professionals. These numbers are free, they're confidential, they're available 24/7, and also available for supportive listening. The Salvation Army offers much assistance for disaster relief, such as meal services, spiritual ministry, counseling, identification, registration, shelter, donated goods, cleanup and reconstruction, and financial assistance. The Minn-Kota region of the American Red Cross serves nearly 900,000 people, covering all of North Dakota and 10 counties in western Minnesota. Disaster action team members assist individuals both through individual and/or mass care assistance. Here are some of the behavioral health resources for Clay County. Clay County Social Services provides information and referral of services that are established through local, state, and federal law. Lakeland Mental Health Center offers behavioral and mental health services This is a 24-hour emergency crisis number that is listed on the screen, which is the 800 number. The Village Family Service Center serves individuals, families, and organizations, from individual and family counseling to child care, mentoring and adoption, to financial counseling and workplace issues. REACH, which is the Rural Enrichment and Counseling Headquarters, provides individual and family counseling, family support, information and referral, food pantry, a thrift store, and educational workshops. The Social Connection provides a safe, comfortable, and supportive environment for persons with a serious and persistent mental or emotional illness who are learning to manage their lives independently within the community. Solutions Behavioral Mental Health Services offer staff who work with individuals and families to treat a variety of mental health disorders. Prairie St. John's Clinic in Moorhead serves. Their services include inpatient care, outpatient care, and also residential care. Clay County Public Health provides adult health, correctional health, detoxification center, environmental health, family health, health promotions, infectious diseases, the Women, Infants, and Children WIC program, and emergency preparedness. The Minnesota Workforce Center in Moorhead really helps job seekers find employment, help businesses find workers, and helps anyone at any stage and plan careers. Lutheran Social Services of Minnesota provides adoption services, home-based family counseling, home management services for older adults, financial counseling, employee assistance, residential service for people with developmental disabilities, veteran and military family support services. Path of Minnesota offers therapeutic foster care, adoption services, respite care, independent living skills training, and emergency shelter placement, as well as family placement. Legal Services of Northwest Minnesota is a private nonprofit corporation which receives federal, state, and private funding to serve the legal needs of low-income or elderly residents of 22 counties. It is not a government agency, nor is it a politically based program. LSNM uses a combination of staff attorneys and private attorneys to deliver their legal services. Here is a listing of 3 additional mental health phone resources for Clay County. Clay County Mental Health 24-hour crisis line, Clay County Social Services for information and referral, and Clay County Public Health for information and referral. Here are some of the behavioral health resources for Cass County. Cass County Social Service has programs and projects that include economic assistance, family service division, adult services, and information and referral. Southeast Human Service Center, their services include mental health services, psychological services, and clinical psychology internship programs. The Village Family Service Center serves individuals, families, and organizations from individual and family counseling to child care, mentoring and adoption, to financial counseling and workplace issues as well. Drake Counseling Services provides chemical abuse and dependency services, individual therapy, and marriage and family therapy. Knowlton, O'Neill and Associates is an independent mental health clinic which provides services to adults, adolescents, children, and families. Mental Health America of North Dakota offers an educational resource center and advocacy and community education as well. YouthWorks offers anger management, day treatment, diversion, family counseling, out-of-school suspension, parenting pathways, and street outreach and transitional living. Dakota Family Services provides mental health care for the residents within the Boys and Girls Ranch and also for adults, adolescents, and children from the surrounding area. Share House and Sisters Path offers residential services, day treatment programs, family services, which include group, individual, and family sessions. Prairie St. John's Clinic in Fargo. Their services include needs assessments, inpatient hospitalization, partial hospital programs, residential treatment, intensive outpatient programs, and clinical services. Fargo Cass County Public Health provides services to residents of Cass County, and these services include immunizations, home visits, and environmental health services. Job Service of North Dakota offers a variety of job support to individuals, businesses, and veterans. Lutheran Social Services of North Dakota is a statewide social service ministry providing nonprofit housing, food, disaster recovery, counseling and therapy, and other services to those within the community. The services really vary, ranging from one-on-one human services like mental health counseling and programs for troubled youth to widespread social services in disaster recovery and affordable housing and hunger relief. Catholic Charities of North Dakota have services that include parenting and adoption, counseling services, guardianship services, and disaster response. Path of North Dakota provides treatment, foster care, family support programs, transition and assessment, family and individual resolution focused services and treatment, foster care independence program, adults adopting special kids, and also wraparound services. Legal Services of North Dakota is a nonprofit organization providing legal assistance in a variety of manners to low-income and elderly North Dakota residents. Here are some organizations that serve both Clay and Cass County. Prairie St. John's Hospital in Fargo I previously mentioned that in the Cass County slides. Sanford Health is also in Fargo, and they offer a broad range of mental health care and treatment with a broad range of outpatient, inpatient, and partial hospitalization services. Rape and Abuse Crisis Center of Fargo-Moorhead provides a wide range of counseling that includes individual counseling, sexual abuse treatment programs, and group counseling. These are a listing on the screen of some online resources for mental and behavioral health within the region and beyond. The American Red Cross, Minnesota Department of Health, North Dakota Department of Health, Red River Resilience, First Link, and the American Psychological Association. So some of those we have gone into greater detail, but we just wanted to have a quick list here for you. And here are a few additional online resources for mental and behavioral health, including the U.S. Department of Health and Human Services and their Substance Abuse and Mental Health Services Administrative area, the National Child Traumatic Stress Network, the Center for Disease Control, and Mental Health America. Additional websites that we really felt were important and should be on our list are Code Red, which is an emergency communications network, National Weather Service Radio, FEMA, and Ready, Prepare, Plan, and Stay Informed, which is the ready.gov website, which really has a great listing of resources for preparing, planning, and staying informed around disaster. Some of the cultural resources that are available within our area are cultural diversity resources in Fargo, Lutheran Social Services of North Dakota, and the Emergency and Community Health Outreach, which is some of you may know as ECHO. Flat Stanley is a book that was written by Jeff Brown. In 1995, Dale Hubert, a third grade teacher in London, Ontario, Canada, began the Flat Stanley project. To do this, he invited other teachers to take part by hosting flat visitors and encouraged their students to write their own Flat Stanley journals. Students made paper Flat Stanleys and began a journal with him for a few days. And then Flat Stanley and the journal are sent to another school where students there treat this Flat Stanley as a guest and complete the journal as well. Flat Stanley and the journal are then returned to the original sender. These adventures can be a lot of fun. In fact, recently I got to go on a 5-week trip to Florida with some friends of mine as Flat Ellie. So they took pictures of wherever we went and sent those back to me. So to introduce this idea of Flat Stanley, you could introduce Flat Stanley before a child you know is impacted by the flood. Send him home, have the students make Flat Stanleys before an evacuation maybe would happen, or even if it didn't, in any setting your work is in, and see what kind of adventures he will go on with their family. They can then bring it back and share their journals with the group around the flood. So to learn more about the project, you can go to flatstanleyproject.com. All right, are there any questions that are specific regarding any of these resources? As I said, at the end of our presentation today, we will be bringing up some things for you to download. But at this time, I am going to turn our presentation over to Jackie Crawford, and she is going to share about the facts of resilience.
Thanks, Ellie. I appreciate being invited to speak with everyone. My name is Jackie Crawford, and I belong to Red River Resilience, a group of volunteers who are working to promote both individual and community resilience. We're really passionate about this topic because it's a positive way to make a difference in how we cope. And there's a great deal of research, it just seems to be building every year, about the importance of becoming resilient in the face of toxic stress. And toxic stress you can think of as prolonged stress that is outside the experience of most of our coping. We'll go over 3 different acronyms as ways of remembering things to do to be resilient. We thought up using the facts as one of those acronyms because when you are stressed, it is difficult to remember what it is you're supposed to do to combat that stress. So I'll talk primarily about the facts, but I'd also like to introduce quickly a couple other of real short acronyms that other people have found to be helpful. One of those acronyms is the 3 C's. And the 3 C's stand for stay calm, stay connected, and stay in control. So stay calm means to build your knowledge and be confident that you can cope well. Stay connected means to access resources that can help you and your family, and there are certainly a great deal of very helpful resources that have been discussed already. And finally, stay in control, which means to take actions to prepare, and that doesn't mean great big global things, but even small steps that can help you be more in control as you face a flood. The other short acronym that is popular is one that can be used with children, and those are the 3 R's. For children, what this stands for is rest, routine, and reassurance. Now these become really important because children, especially small children, need rest. They need naps, they need a sleep schedule. They need routine, they need predictability, activities that can continue as much as possible even within the confines of a disaster like a flood. regular family activities so that not everything is lost during a disaster. And finally, reassurance, which is not minimizing their feelings, not telling them that it'll be okay, but more letting them know that people are working to protect them and their community from the flood, and that someone will be there to help them. Finally, to reassure them that we know what to do and that we will take care of them and ourselves. So have a family emergency plan, for example. So those are the two other acronyms that have been popular, and I just introduced those quickly because they're short and I believe easy to remember. The more prominent one that I will spend more time is the facts. And so overviewing everything, I'm hoping that by the end of this presentation, you'll have a much better idea about resilience, what it is, and what you can do to combat your own stress. I also hope that by defining resilience and taking a look at the 5 steps, you'll have a better tool to use not only for yourself, but with others that you might be working with. And finally, as we go through the different facts of resilience, I'll give you a chance to do some activities that will help you apply this information to your own life. So what is resilience? Well, we can think of resilience as the ability to bounce back from any crisis or adversity and to adapt well to the changes that occur in your life as a result of that crisis or adversity. Everyone has the capacity to be resilient. It's not something that we are necessarily born with. You can learn it and you can develop your resilience skills at any age. These skills involve ways of thinking and behaving that result from successful coping and adaptation to challenging situations. And these might even be developmental challenges that we all face as we grow older. The key components of resilience are expressed in the acronym FACTS, and this stands for foster hope, A, act with purpose, C, connect with others, T, take care of yourself, and S, search for meaning. So let's start with foster hope. What are the components? Well, to foster hope means to deal with a crisis or challenging by focusing on the positive. This is not a Pollyanna way of thinking, but is more being realistic to think about there's more than one way to peel an apple, and there's more than one way to think about what it is that's happening. Fostering hope means to also be confident about yourself, that you are not entirely helpless. It is not entirely hopeless. It also means to be putting things in perspective, that you have faced difficulties before and you can face this one. So focusing on the positive means that you have a positive and optimistic outlook. You feel energized and able to face difficult situations directly. You can imagine where you want to be and how things might be better in the future. Recognize that even in difficult times, there are some positive aspects to life. Fostering hope also means to have confidence in yourself. And here we mean that we want you to look at your ability to cope as an opportunity, a challenge to remember what you've done before and apply them, to try to foster your survivor mentality and recognize that you have the ability to learn and use your resilience skills to deal more effectively with stressful circumstances. When you put things in perspective, you try to put your current problems in a context that helps you adapt and gives you a long-range perspective. Change is a natural part of life. You may not be able to prevent bad things from happening, but you certainly can turn your energies toward coping effectively and being a source of support for others instead of ruminating over what might go wrong or what has gone wrong. The next way of being resilient is to act with purpose. We've talked about helpful ways of thinking about a crisis or disaster. Now we want to turn our attention to actions you can take to improve your ability to bounce back and adapt. So let's make a plan. Begin by clearly identifying the problem and brainstorming solutions. Brainstorming is not being critical about the options that are coming up, but letting your brain flow because creativity comes from that flow. Afterwards, you can evaluate and choose your best option, and from that, create an action plan. This is not necessarily a long-range thing. This can be something as short as, what am I going to be doing in the next 5 minutes? Realize that changing circumstances might require you to abandon old goals and adopt new ones, or to use different strategies to reach your goals. I remember one time when, during a flood, I had remembered that there were times when there were pickup trucks, or not pickup trucks, but dump trucks lining the roads and a dike down the middle of the road in Moorhead. And there were National Guard soldiers directing traffic because the crest was expected to be quite high. Well, that went fairly well. The next year, as I was coming to an intersection that had stop signs, I looked to my left and I saw a row of 6 dump trucks, all filled to the brim with piles of dirt, and a National Guard soldier directing the traffic. And right away, my anxiety started to build, and I had to physically stop myself from acting and remember that I had a purpose, and I had to make sure that I met my purpose. And my purpose right then was to be careful with my driving so that I could get home. When we act with purpose, we move toward our goals. So you take decisive steps to solve the problem and reach your goal. Rather than letting yourself being overwhelmed by the magnitude of the situation, try to focus on small achievable steps that you can do in the moment and take you in the direction you want to go. Take time to reflect on your progress and celebrate your accomplishments. Even giving yourself a way to go is a good idea. Acting with purpose also means that you engage in active coping. You don't let yourself get overwhelmed by the enormity of the situation, even though it's normal to experience strong emotions during any crisis or adversity. Active coping could be things as talking to someone that you trust, or writing your thoughts down and feelings in a journal, much like that has been described in the financial book that was described earlier in this webinar. Avoid dealing with problems and just wishing it away. Don't rely on unhealthy forms of coping, such as excessive alcohol use. 1 or 2 extra drinks in the moment might not be such a bad deal, but it gets to be a habit, and before you know it, you're down an unhealthy road. The next way of coping with and building our resilience in the FACTS acronym is to connect with others. In the heart of resilience is connecting with others, and it's what research says really helps us the most. Research has showed us that children growing up in situations of extreme stress or toxic stress, such as ongoing, overwhelming poverty or abuse, can still become successful adults as long as they have adaptive, capable adults in their lives who believe in them and who offer their nurturance and guidance and support. Let's take a look at these 3 ways of connecting with others that we have listed here. So how do we maintain relationships? Close, positive relationships with family and friends, people who are constructive and adaptive, can be a good buffer against stress. Share your thoughts in the moment and your feelings with someone you can trust to listen without judging you or trying to fix it. Draw comfort and strength from the support of others who care about you. Even in the hallways at work, a passing by, how you doing, can be a realistic, I'm working on coping with this. Remember, you need to include other people in your life, and they need you too. People derive a lot of benefits from helping others. So take a moment and think, who are 3 people you can talk to during a crisis or disaster? So what's another way that we can connect with others? Well, giving and receiving help. As I just referred to, there are benefits to giving help that affect us on a neurological basis. Research has shown that the neural hormones that we have, the habits, my words are poor right now. But anyway, it affects us at a neural level, that we have a sense of well-being when we give help to others. Accepting help also not only helps us, it helps others to feel like they are a positive influence. So do what you can to help others and serve your community, and recognize that accepting help is a way of joining with others. You are important, and remember, helping others benefits the helper. So, okay, let's do another activity. What are 3 things you can do to help others during a disaster? Doesn't have to be a big thing, doesn't have to be a long-term thing. The third way we connect with others is to spend time with them. It's important to take time for social activities with friends and family, even small things in the midst of a disaster. There is a compelling need to take care of the flood, to make sure that you're not overwhelmed. But if we don't take time to relax, we will burn ourselves out. Take time to come together with people who share your interests and your beliefs. Be active in civic groups or faith-based organizations or other local groups that provide social support and can help you reclaim your hope and your energy. The next way of being resilient is to take care of yourself. It's easy to forget that taking care of yourself helps you have energy. And so it may sound like the old tired mantra of getting enough sleep, make sure you get good nutrition and exercise. But again, research has showed us that when we take care of our bodies, we're taking care of our minds. And when we take care of our minds, it helps our bodies. Good self-care is a basic component of being able to cope and adapt well to challenging circumstances. So let's take a look at some of the ways you can take care of yourself so that you can do a better job of taking care of others. First, we want you to take care of your body. When your body is working rest, the rest of you feels well, and you're better able to face difficult challenges. You do yourself and others a favor by eating nutritious foods, getting adequate sleep, and staying physically active. Healthy habits, in addition to good hygiene, will protect you from a variety of illnesses. On the other hand, it may be hard for you to get a good night's sleep in a time of heightened anxiety. It is still your job at night to sleep and not to solve problems. If you don't get a good night's sleep, things tend to snowball, and the next day you will probably be more irritable, you will have more difficulty concentrate, and you will be less likely to solve the problems you have. So think about this. What are 3 ways you could take care of your body during a crisis or disaster? Next, when we take care of ourselves, we take time to relax. It's easy to feel guilty when you take time to relax, but relaxing activities not only provide a restful break, but they also keep you in touch with enjoying life. When you are in touch with that, then you're better able to face stressful situations. Again, take a moment now and think about yourself. What are 3 relaxing activities you could do during a crisis or disaster? It could be something as simple as taking a short walk. The next way of taking care of yourself is to nurture your spirituality. We're not talking about religion. We're talking your sense of a higher being. What is important to you? How can you make a difference in the world? Find activities that bring clarity of purpose and a sense of connection, such as meditation, religious practices, or spending time in nature. Take a moment now and think for yourself, what are 2 ways you can nurture your own spirituality? Our last way of being resilient is to search for meaning. Searching for meaning usually comes into play after the crisis has passed. At this point, you're looking back on your experience, and you may realize that you've found deeper meaning in life, or you have changed in some fundamental way as a result of the struggle. In my own life, I remember having survived a flood and having to move our house, and the next year, well, maybe not the next year, 2 years later, looking at where my house was and thinking, I like this better. I would never have chosen to have gone through what I went through, but I could find some joy in the events as they happened later. I also found that I was able to look forward the next time I faced a flood and said, you've done this before. You did it. You can do it again. Searching for meaning is finding positive meaning. We all want a meaningful life that can bring us inner peace during difficult and stressful times. Searching for positive meaning in the crisis or challenging situation you have experienced means remembering things that have been beneficial to you or to someone else that you care for. Next, when we search for meaning, we learn about ourselves. Think about the stressful experience you have been through. What did you do to deal with it? What have you learned about your own coping? Pay attention to what worked well and what would you like to improve. Not to be critical, but to think about, I've done this before, not everything went well. What can I do to improve it in the future? Take a moment to think now. What have you learned about yourself as a result of coping with a crisis or disaster in your own life? Finally, searching for meaning means to look for personal growth. Our struggles with problems and adversity often give us positive growth. Look for changes such as a renewed appreciation for life, closer relationships, deeper spirituality, or a greater perception of inner strength. Our next activity is to think for yourself, how have you changed or grown in a positive way as a result of a struggle that you have been through? Resilience is a personal journey. We're encouraging everyone today to be creative and to use the tools we've discussed today to enhance your personal resilience. You can also apply these concepts to building the capacity for resilience in other people, in other places, and with other projects that you hold dear. If you're faced with someone who's not coping well, and you are one of those people who can listen and not be judgmental and not interrupt, you have the ability then to listen for their own coping, their own resilience, and let them know what you hear. Because often when people are in crisis, they don't recognize their own strengths. In your personal journey, think about developing your own resilience plan. What's a current situation you're facing that requires resilience? Consider what kind of situations you might face in the future. What are some new strategies you might try? What are some of the resilience tools you've learned about today that you might apply? Think about and write down in order a way that you might face a current or future crisis or disaster in a more resilient way. Don't ask too much of yourself, but do something that you have a high probability of being successful with. Who can you ask to be a resilience partner, to be listening non-judgmentally, and to help you stay on track with any changes you want to make? What is one step you can make today to become more resilient? I want you to think about a couple other resources that you might take with you as you consider the benefits of building your own and others' resilience. Some listed here include American Red Cross, the Minn chapter, Disaster Mental Health Services, we have the phone number here, the American Psychological Association, APA.org, the page that says Help Center, liveyourlifewell.org, and lastly, our own organization, redriverresilience.com, which has these acronyms and how to apply them listed here. Developing resources and resilience is an ongoing process. To help you on the way, I hope you will remember these resources that you have learned of today and use them. Thank you for giving me the opportunity to speak with you today. I hope you find this information helpful. Are there any questions that anyone has for me? Okay. If not, I have one other thing to share with you. This art quilt was created by Julie Richardson of Fargo to commemorate the Red River flood of 2009. It's based on an idea presented by a caller to a radio program during the flood. The radio program host had been discussing mysterious circles that were appearing in people's photographs of the river. A caller explained that these circles were orbs, mystical beings such as angels and fairies who were coming to the aid of the community during the flood. The radio host didn't laugh or criticize her idea, but simply said, "We'll take all the help we can get." This quilt depicts the hope expressed by that caller. Now it's your turn. We hope you will use your own creativity to F. Foster hope, A. Act with purpose, C. Connect with others, T. Take care of yourself, and S. Search for meaning. I'm going to turn it back over now to Ellie and let her close.
Thank you, Jackie. And I too want to ask if there are any closing questions. I am going to pull up a box that has the certificate, the 2-page resilience fact sheet, and the resource fair white paper. And if you click on the item, then down at the bottom left, you can upload the file directly to your computer. Also here is a link to our evaluation. If you would take, there's about 5 questions, really quick, maybe 2 minutes. Just click on evaluation and browse to, and that should just open right up on the computer that you're at. I'm also going to put my email in the chat box. So if you have any trouble downloading these resources to your computer or opening the evaluation, please feel free to send me an email, or if you have any other questions or comments. I will leave this open so that you can take the time to get these resources. And I just want to say thank you for being part of our Resilience and Resource Fair this evening. and I look forward to hopefully hearing from you in the future. Thank you and have a great night.